We're talking about cicatricial alopecia, a hair loss condition that's not as well known as some other types. Stick around as we unravel the mysteries behind this condition, exploring its causes, symptoms, and available treatment options. Before we dive in, make sure to hit that subscribe button and ring the notification bell, so you never miss out on informative content like this. So, what exactly is cicatricial alopecia? Cicatricial alopecia, also known as scarring alopecia, is a hair loss condition characterized by inflammation that destroys hair follicles and the replacement of these follicles with scar tissue. This results in permanent hair loss. Unlike some other types of alopecia, cicatricial alopecia is irreversible, making understanding its causes and early detection crucial. Now, let's talk about the causes. Cicatricial alopecia can result from various factors, including inflammation, autoimmune diseases, and infections. Sometimes, it may be a secondary effect of other skin conditions. Understanding the underlying cause is essential for effective management. Conditions such as lichen planopilaris, frontal fibrosing alopecia, and discoid lupus erythematosus can lead to inflammation and scarring of the hair follicles. Some autoimmune diseases, like scleroderma, may cause the immune system to attack hair follicles, resulting in scarring and hair loss. Certain infections, such as fungal or bacterial infections of the scalp, can lead to inflammation and scarring, contributing to cicatricial alopecia. Moreover, physical trauma, burns, or other injuries to the scalp can cause scarring, which may result in permanent hair loss. Genetic factors, some medications, particularly certain cancer treatments and immunosuppressive drugs, and exposure to radiation, especially in the treatment of cancer, can lead to scarring and permanent hair loss in the affected areas. There are different subtypes of cicatricial alopecia, each with its unique characteristics. Some common types include frontal fibrosing alopecia, central centrifugal cicatricial alopecia, and lichen planopilaris. Identifying the specific subtype is crucial for tailoring an appropriate treatment plan. Frontal fibrosing alopecia primarily affects the frontal hairline and eyebrows. It is more common in postmenopausal women and is characterized by a band-like recession of the hairline. Central centrifugal cicatricial alopecia predominantly are seen in African American women. It starts at the central scalp and radiates outward. The exact cause is not fully understood, but it is often associated with hairstyling practices and may have a genetic component. Finally, lichen planopilaris is an inflammatory condition where the immune system targets the hair follicles, leading to scarring. It often presents with redness, scaling, and follicular plugging. There are other subtypes of cicatricial alopecia, which I will discuss in a later video. Now, let's discuss treatment options. Unfortunately, there's no one-size-fits-all solution for cicatricial alopecia. However, dermatologists may recommend anti-inflammatory medications, immunosuppressants, or in some cases, surgical intervention to address scarring. Early detection is key, so if you suspect cicatricial alopecia, consult with a healthcare professional promptly. The treatment of cicatricial alopecia. Scarring alopecia depends on the specific type of alopecia, its underlying cause, and the extent of scarring. Topical corticosteroids can be applied directly to the affected scalp to reduce inflammation. Intralesional corticosteroid injections can be injected directly into the affected areas for localized treatment. Or, oral or injectable corticosteroids may be prescribed for widespread or severe cases. Medications such as tacrolimus and pimecrolimus can be applied topically to modulate or control the immune response and reduce inflammation. Moreover, Hydroxychloroquine can be used in cases associated with autoimmune diseases like discoid lupus erythematosus. Next, immunosuppressive drugs such as mycophenolate mofetil, cyclosporin, azathioprine can be used to suppress the immune system and may be prescribed for severe cases. If bacterial infection is present, antibiotics may be prescribed to address the infection and reduce inflammation. Moreover, gentle hair care practices, such as avoiding tight hairstyles, and protecting the scalp from the sun can help manage symptoms and prevent further trauma. For cicatricial alopecia associated with autoimmune conditions, treating the underlying autoimmune disease may be necessary. It's important to note that not all treatments are suitable for every individual, and the choice of treatment depends on factors such as the specific diagnosis, the severity of the condition, and the patient's overall health. Additionally, early intervention is crucial to managing scarring and preventing further hair loss. Consulting with a dermatologist or a healthcare professional experienced in treating cicatricial alopecia is essential for an accurate diagnosis and personalized treatment plan. Furthermore, regular follow-up appointments are typically necessary to monitor progress and make adjustments to the treatment regimen as needed. Prevention is challenging due to the nature of cicatricial alopecia, but early intervention can help manage symptoms and slow down progression. Coping strategies include support groups, counseling, and embracing alternative hairstyles to boost self-esteem. Preventing cicatricial alopecia. Scarring alopecia can be challenging, as it often involves addressing underlying causes and managing various contributing factors. However, some general measures and practices may help reduce the risk or minimize the impact of certain types of cicatricial alopecia. Seek prompt medical attention if you notice unusual hair loss, scalp changes, or symptoms such as itching, redness, or scaling. Early diagnosis and treatment can help prevent further damage to the hair follicles. Minimize the use of harsh chemicals, such as strong relaxers, perms, or dyes, which can damage the hair and contribute to scarring. While stress alone may not directly cause cicatricial alopecia, managing stress can contribute to overall health and may indirectly impact the immune system, reducing the risk of certain autoimmune-related alopecias. Take precautions to prevent physical trauma or injury to the scalp. This includes avoiding accidents, burns, or other forms of trauma that can lead to scarring. It's important to note that not all cases of cicatricial alopecia can be prevented, especially those with genetic or autoimmune origins. Moreover, early intervention and professional medical guidance are crucial for managing and treating cicatricial alopecia effectively. If you are concerned about hair loss or scalp changes, consult with a dermatologist or healthcare professional for a thorough evaluation and personalized advice based on your specific situation. That wraps up our exploration of cicatricial alopecia. If you found this video informative, give it a thumbs up, and don't forget to share it with others who might benefit from this knowledge. If you or someone you know is dealing with cicatricial alopecia, remember that seeking professional advice is crucial. Thanks for joining me today on Forever Nidge. Stay informed, stay positive, and I'll catch you in the next video. Take care and happy viewing.